A routine visit leads to emergency surgery. On today's All Things Heart, what happened and why this patient now says she feels better in her 60s than she did in her 30s.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. It was a routine visit to the podiatrist that caused some big concern when Cheryl Craig says the podiatrist couldn't find a pulse in her foot. As Janine Kiesling shows us, a cardiologist confirmed Cheryl's iliac artery, which is pretty important. It provides blood to the legs, pelvis, and reproductive organs, was 100% blocked. She was told she needed surgery right away.
Look at all of them.
Cheryl Craig loves to go to the park with her granddaughter Chevelle.
Oh, there's fish.
But until recently, this wouldn't have been possible.
I couldn't hardly walk. I was holding on to baskets at the stores and couldn't walk more than 5 or 10 minutes before I had to sit. It was bad. I hurt.
That pain, Cheryl says, has been with her since her 30s when diagnosed with restricted blood flow from Berger's disease, a progressive condition that blocks blood flow and is often linked to smoking. With her diagnosis came many surgeries.
And it started off when I had my toes amputated, and I was like 32 when they would going from each toe doing angioplasties through my legs to try to clear it out. Because they did so many angioplasties through my groin area, it was extremely hurtful when I'd walk.
That was just a way of life for Cheryl, and it was the only way her grandchildren who live with Cheryl had ever seen her.
It was really hard because it's like I couldn't do nothing to help her because I didn't know what was happening.
But in the fall of 2022, when her podiatrist noticed the pulse in her feet was faint, he knew Cheryl was in trouble. He sent Cheryl to a cardiologist who knew this time Cheryl needed more than an angioplasty. She needed a specialist. He sent Cheryl to Dr. Biggs at the University of Kansas Health System.
He said they're going to cut me from the middle of my chest all the way down to the bottom, open me up, and he had to reroute my arteries to where they would start working and pushing blood through my legs.
It was just scary watching her go in at first, mainly because it's a very major surgery. We don't know if it's going to go well or go bad.
But Cheryl knew she didn't have a choice, and she would do anything to feel better. That November, Dr. Biggs operated on Cheryl. She noticed a difference immediately, and so did her family.
It was rough at first, but when I got up and I started realizing I could walk farther than I used to, it felt good. It's amazing how much difference it is.
When we walked into her room, we saw that she was recovering. She was in a lot of pain, I could tell, but it looked like she felt much better.
Cheryl says she now looks forward to getting out and doing things with her grandkids, and she credits Dr. Biggs for giving her back a pain-free life to live and enjoy.
I just love him to death. He's a wonderful surgeon, and he's a good person.
We are so pleased to welcome Cheryl Craig's vascular surgeon today to our program, Dr. Joed Biggs. Thank you so much for being here. And between the doctor and me, we have this very interesting looking torso. It's a model. This is going to be key to our discussion later on in the program to explain how Dr. Biggs was able to save Cheryl. So we're going to have you show us on this model what went into this surgery you did on her. It saved Cheryl's life. She's feeling so good. She's back to work full time, so she couldn't join us today. She so wishes she was here. I bet she'd just give you the biggest hug.
Yeah.
She absolutely adores you, Dr. Biggs. So we're gonna tell her story throughout this program. One of the things I want to ask you about right out of the gate is that Cheryl told me she'd been smoking since she was 18.
Yeah.
When she met you. That's almost 40 years. You inspired her to quit.
Yeah, so one of the things I work with my patients is really focusing on what can we do to optimize them for a surgical intervention. I think we're going to invest a lot of resources. We're going to take some chances to try to help them. What can we do to optimize their long-term outcome?
Right.
And so I approach like that, and I approach it like that with Cheryl. I say, you know, we look at this as an opportunity for us to have a launch point to make a lifelong change in your life. We want to do everything we can to make this work as long as possible.
You said the magic words to her. She says that you were firm, you were blunt, and you were kind. She said that you told her, if you don't quit, I can't fix you.
Yeah.
Which is so important, and it's stuck. So she kicked the habit. What is it about smoking that harms the vascular system in the heart and made it so key for this particular surgery for her to stop?
Yeah, so smoking in and of itself causes lots of inflammation in blood vessels, and also leads to plaque buildup and contributes to that significantly. It also greatly increases the rate of scar tissue formation at any point where I make a cut or sew something onto an artery, to the point that the rate of a graft blocking off, or having a blockage of that graft, or having to do multiple interventions on that graft goes 10 times higher if people are actively smoking at the time of the surgery. So it's very important.
She has Buerger's disease.
Yeah.
What is it that smoking does to the body? Does it put them at risk for developing Buerger's disease? Does it cause it?
Yeah, so you can't have Buerger's disease unless you are a smoker.
Okay.
Buerger's disease is also called thromboangiitis obliterans, which is just the fancy term for it. In essence, it's I think of it as being allergic to cigarettes, and that your arteries are so heavily involved by blocked up by the smoking, especially in the small arteries going down to the feet and hands, that they just completely block off with platelet plugs and clots and plaque buildup very aggressively. And so really the only good treatment for Buerger's is to stop smoking.
And she did. She kicked a 40-year habit because of you. We talked about this blockage that Cheryl had. How did the blockage impact her heart function?
So her heart is actually pretty good, thankfully. She's managed to avoid significant heart disease to the point that she's had to have procedures on her heart. Her heart function's reasonable. So she's been somewhat spared in that sense. It's true, though, that having a blockage in her aorta can increase the amount of pressure the heart is seeing and lead to changes in the muscle in the heart and enlargement of the heart muscles that can be damaging over time. And we do know also that smoking is associated with significant risk of coronary disease just as much as associated with the risk of leg artery disease.
We're going to get to this super cool model in a minute. First, I want to talk about Cheryl's CT scan before her surgery, because we have that. I'd love for you, Dr. Biggs, to explain to us what we're looking at here.
Yeah, so a CT scan is like thin cut x-rays through the body. In this case, we're looking at the body in slices from the head down to the toes.
What is that?
That circle is showing where there is what we saw before was healthy aorta up by the kidney arteries and by the intestinal artery. And then right now we're seeing where the aorta is completely blocked with plaque or clot. There's just no flow going there at all. And if we keep going, we can see where Cheryl had previous stents placed down in the common iliac arteries, which is the first part of the arteries that go to the leg. And then that blood flow comes back when we get down to the lower part of the belly arteries there and the external iliac arteries, where there's restoration of flow through other pathways. But that blockage is long, basically from right at the kidney arteries all the way down to all the way down through those stents.
You had to perform something called an aortoiliac bypass. As Cheryl said, you told her, I don't know if you said it this way, she said, he's got to slice me open and reroute my arteries, which sounds dramatic. Well, how did you break the news to her? And I'm going to lift up this model so you can help explain what it is in a little bit. But
yes, absolutely.
How do you tell a patient, I got to cut you open and reroute your arteries?
So I do tend to be relatively straightforward and honest, and as she said, blunt. So I'll say, you know, one of the reasons that it was important that we talk about surgery is because we're trying to make sure that we don't limit any issues or don't cause any issues with the kidneys. Right. And since our blockage came up to the kidney arteries, in that situation, surgery really is a great option to make sure that we keep blood to the kidneys when we do this reconstruction or rerouting of the blood vessels.
So you said it how it was, which
Yeah.
Cheryl is so sweet. I've talked to her a lot on the phone. She's very straightforward, and you're the Cheryl whisperer. She quit smoking, and she adores you, and you were able to talk to her about this very complicated surgery. So now to the model, an aortoiliac bypass. What exactly do you do? This is obviously, explain what this is and
Yeah, sure.
what you do.
So this is a model of the aorta. This is actually going to show a little bit of an aneurysm here, which would be enlargement. But in Cheryl's case, she had blockage. Either way, her blockage extended from right up here, which would be where the level of the kidney arteries is.
Where is this on her body? Or are these her?
Sorry. So on the body, this would be where the diaphragm is, or the rib cage is kind of up here.
Okay.
And then this would be where your kidney arteries are. This is kind of representing the kidneys here.
Okay.
And this is way down in the back, so in the belly, way deep down, almost by the spinal cord is where we're talking about.
Way
so
back
way
in the
back,
belly.
post, behind the intestines and everything.
So like if you were to look through her belly button, would it be about there? Like, is that where this is happening?
The belly button would be right about in this area in general. And yeah, one of the key things is that this is very far back, so we have to move everything out of the way to get back there. So once we've gotten things exposed, what we did in her situation is we actually briefly did block the blood flow above the kidney arteries, as well as blocking the flow through the kidney arteries to let us open the aorta here, clean out the start of that aorta right by the kidney arteries.
That's where the blockage was?
It's extended up there, yep. And then sew that closed a little bit, block here, and then sew a graft like this in to replace that portion. And we actually sewed that in with fine suture all the way around, just by hand. And once that's sewn in, we restore flow to that. And then in her case, we sewed in down, if you can move down here.
Should I lift it up?
Down here, no, that's good.
Okay, yeah.
And then down here. So then to each leg, basically, but all within the belly in her operation. Sometimes we have to go to the groins during this surgery to get blood flow to the legs.
How long does that surgery take?
This takes about half a day, is about how long it took us to do that surgery.
And you're just standing there the whole time with someone's life in your hands. Do you take any breaks? Do you just sit down for a minute or two, or are you just laser focused the whole time?
No, we try to get, so it's important to get the operation done as expeditiously as possible. We know that reduces the rate of issues and complications, so we just keep going.
You just keep going. I've always wondered this, when doctors say they have to get around organs and move things out of the way, where are they going? Are you taking them to the side?
Yeah, so quite literally we
there?
do actually move them to the side. Either in this kind of operation with open abdominal surgery, we either physically pack the intestines inside the belly tight, out of the way, or we pull them out. Those are the two options.
Fascinating.
Yeah.
What are the biggest risks with the blockage that Cheryl had? What would have happened if she hadn't seen you?
So the things that you worry about when you have a blockage of the aorta and the iliac arteries is not just that you can't walk because it hurts to walk because you don't have blood flow going to your legs, but you worry about more downstream consequences that are even more severe that can progress over time. One of those being what we call ischemic rest pain, which is there's so little blood flow going to the leg or foot that even at night you can't sleep because there's so much pain in your foot because there's just no blood flow. It feels like you're sitting on the bus and your leg went to sleep, but it never stops being asleep.
She had talked about how she, in her 30s, had her toes amputated.
Correct.
It was because of Berger's disease, because of this blockage. It was.
Well, so actually that's interesting. So when she was in her 30s, she didn't have this complete blockage of the aorta.
Okay.
She had different blockages lower down. But definitely you'd be at risk of developing new wounds, new ulcers, or new issues like that that would need toe amputations, things like that, if a blockage like this was not addressed.
Was Cheryl an extreme case, or do you commonly see people that come to you who've already had amputations because they have so many other problems going on?
So that does happen. Often this is so blood vessel blockages are a lifelong problem often,
Right.
because of the things that contribute to them. So if you've been smoking your whole life, you're at risk of having had prior issues and then now having ongoing issues like this. That is true.
It's an extensive surgery, as you just talked about, rerouting the arteries. What's the typical recovery for a patient?
So from this kind of surgery, I usually tell them about 5 days to a little over a week in the hospital. And most of that recovery is focused on in the first period, making sure there's no major complications or issues, and then letting the intestines recover to let them wake up from surgery, and also working on pain control and walking and mobility. And so that's kind of the progress there.
Cheryl repeatedly has said, and she said it again last night when we were texting each other, she feels better now in her 60s than she ever did in her 30s. She also said she's lost 70 pounds since this surgery. Is that typical, or is Cheryl the model patient?
Cheryl has done a very good job of making several lifestyle changes because, or as a result of our discussions, or as a result of her motivation related to the surgery and how her life has gotten so much better. And she's really at charge of that. She's done an excellent job of taking care of herself and taking charge of her health since the surgery.
Do you develop these personal relationships with each of your patients? Because Cheryl lights up when she talks about you. You light up when you talk about her.
You know, I do think it's one of the things I love most about my job is being able to connect with other people, and so I do enjoy that portion. And one of the things that's nice about being a blood vessel surgeon is I get to be with these people throughout their entire life. So it's not one surgery and we're done. You know, I'm going to be watching things for the rest of her life and making sure we're doing everything to help her kind of long term. So
yeah.
I do enjoy that.
You become old friends.
Yeah.
You become friends. We have lots of community questions. We love answering your questions. Dr. Biggs, Joed Biggs, is here to answer them all. Send them to us right now on YouTube, Facebook, the X platform, and the All Things Heart email. You can find all of the ways to connect with us right there on your screen in real time. And right out of the gate, we have a question from Jean Reardon. Jean wants to know, how many hours is half a day? You said you were performing. This is what all of us civilians are. I can't do anything for half a day straight except sit still. I can't even, no, that's false. I can't sit still for half a day. How many hours are you standing on your feet operating?
Yeah, so I think in Cheryl's case, this was a 4-hour operation.
Okay, so 4 straight hours.
Sometimes there are operations I do that are much longer than that, but this, when I said half a day, I meant half a working day.
What's the longest surgery you've ever performed where you've just been standing there?
14 to 16 hours.
16 hours?
Yeah.
Wow. I want to do a show on that another time.
No,
okay, I'll poke around in that in a little bit. Okay, Amy wants to know, how long does the graft last, and is there an expiration date? And as you answer that, I want you to show again, where is the graft, and how long did the graft last?
So this graft is made of PTFE, or plastic, same stuff that Gore-Tex shoes are made out of. It just is specifically designed to be implanted. There is no expiration date once implanted. There's a expiration date on the packaging in terms of how long it's sterile in a package until it's implanted, and that's just a normal thing. These do tend to be long-lasting procedures. We expect that 10 years that the graft is still open over 90% of the time.
And what would happen if it expired? Do you have to do this again? How would?
If the graft were to block again, it can be a very difficult situation managing that. There's a couple of different things we can do.
But it's rare.
But it's not very common, thankfully. But trying to redo the surgery is very challenging.
Which is why Cheryl's avoiding that by changing her entire life around, including quitting smoking. Mark has a question. Mark wants to know, could Cheryl have had this procedure done earlier in her life to avoid anything? Or was this procedure around 30 years ago?
Actually, it was around 30 years ago. When in her 30s, it was a lower down problem that she was experiencing that was leading to those blockages. If she had had this extent of blockage at the time in her 30s, she wouldn't have been able to heal her amputations of her toes. And so while it definitely started then with her disease process, she was at least able to get by with those stents in her iliac arteries for some time to help her be able to heal those things. But and so this was kind of a new and worsening manifestation of the same problem.
Lori wants to know if Cheryl will always have Berger's disease, or can it be cured?
If you're not smoking, you no longer have a problem, meaning that you're not going to progress. Now, whatever blockages were there are not going to necessarily get 100% better, but at least things aren't going to get worse.
And what are Tammy wants to know about medications. Are there any medications she also has to continue taking?
So yeah, once someone has had a blood vessel surgery like this, or that can include coronary interventions, so if they've had a coronary angioplasty or stenting, or if they've had a coronary bypass surgery, we do keep people on long-term medications to reduce their risk of recurrent plaque buildups that would be life or limb-threatening, including an antiplatelet such as aspirin, cholesterol-reducing medications, and sometimes other blood thinners like Xarelto at a low dose to reduce the risk of recurrent issues.
Nice comment from April Collins. April writes, Dr. Biggs, thank you for the important work that you do. We all thank you. You have a lot of grateful patients. And then Jeremy has a question. He writes, I had a similar question that Jean had about the sheer time spent doing this procedure. What if you need to go to the bathroom or are thirsty or need a snack to get your energy up? That's such a good question. I actually was wondering that, but I didn't want to ask you. But so thank you, Jeremy. What happens if you have to go to the bathroom?
You know, there's something about doing an operation of this magnitude that all those things go out the window. You're kind of fight or flight for however period of time you're doing it. I mean, you stay very calm, but you're kind of just used to this. You know, your body knows what it's doing. And so I prepare for the surgery. I make sure I've eaten a decent meal beforehand. I make sure I've gone to that I've made my needs met beforehand, and then you just get through it.
Do you stop drinking liquids an hour before?
I'm chronically dehydrated, to be honest, yeah.
Because you're trying to prevent that, oh man. Becca has a question. Becca wants to know, is this a last resort treatment, or is this something people actually can opt for before they get to the level that Cheryl was at?
So I guess that question is getting at, we definitely look at options that are less invasive if that's a good option for the patient. So I offer open surgery like Cheryl had. I offer stents like Cheryl had before. So it just depends on what's best for the person I'm talking to, what would work best for them to try to improve blood flow to their legs in this situation.
It's time now for our final thoughts of the program. And I told you how Cheryl and I were texting last night. She's so sad she couldn't make it, but she did send me this text. She writes, this is Cheryl's final thoughts. I want to thank Dr. Biggs for taking such great care of me. I could not have asked for a better surgeon. He saved my life. I am so very grateful. I can now do things I never could before. I can even mow the lawn, which is something I love to do. I can shop with my granddaughters. I always tell people that if you have a vascular problem, you have to see Dr. Biggs because he is one of a kind. The health system did not pay Cheryl for this endorsement. She loves you.
Yeah, she's very kind.
What's your reaction hearing a patient talk about how you changed their life, and she feels better now in her 30s than she did in her 60s?
I'll be honest, I loved that video that you all showed at the start of the program. It's so nice to see her being able to enjoy life, walk with her granddaughter, enjoy the things that we all enjoy. It's those small things that make such a big difference, and to have been a part of her story, I feel pretty blessed.
And we're blessed to know you, and Cheryl and her grandchildren are so happy that she's back and she's healthy. We love sharing the incredible work that our doctors do here at the health system. It's amazing. We also love showing our viewers what life is like for our doctors outside of the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Dr. Biggs, you are so interesting. So let's get first to your beautiful family. You have three little ones at home.
Yeah.
What are their ages?
5, 4, and 2. My oldest is Emma. She's in kindergarten.
Are you sleeping?
There. We do get sleep around our house all these days, yes.
And your wife is a physical therapist?
Yes, she's a physical therapist, and she's now doing the hard job of staying home and managing the household, I like to say, and helping
the kids. That's a sign of a good partner. Dr. Biggs, right out of the gate, said she's the one with the hard job.
Yeah.
Right? Where are you here?
This is in Breckenridge just recently.
Nice.
It was an April ski.
And
it was pretty fun.
Are you teaching your little ones how to snow ski?
Yes. I mean, I've gotten Emma on the slopes a couple of times. More to come on that. So,
yeah. See, and did any of them talk about wanting to be a doctor?
Actually, my my oldest does actually. We'll
Really?
see. We'll see how that goes over time. But she wrote it on her little first day of kindergarten that she wants to be a doctor.
Wants to be a vascular surgeon?
We'll see.
Well, that would be pretty cool. Another thing I learned about Dr. Biggs is you're learning how to play the piano to relax.
Yes. Mm-hmm. Yeah, I find it a good way to, learning a musical instrument, a good way to kind of decompress after stressful long days, and also something to do with my children because they're also learning.
Right.
And so something I always wanted to do, so I've been doing that.
Oh, and by the way, as the show open was rolling, by the way, I'm starting a farm. That's what he told me. So we're going to bring pictures of all this stuff. I'm going to get you to send me video of you playing the piano and your farm. What inspired you to start a farm? You have 3 little kids. You're a surgeon. You're busy.
So it was always my wife's dream to own horses and ride them in shows, and now we're also going to be breeding horses. So we are making those dreams come true.
You're doing everything. Well, thank you so much for being with us today.
Absolutely.
And a huge thank you to Cheryl for sharing her journey. Cheryl, don't worry, we will send you a copy of this program, and she would just give you the biggest hug if she was right here. Thank you for watching and joining the conversation and sending in all your questions. Coming up next week on All Things Heart, a years-long journey to save his failing heart, how Brian Pitts went from patient to survivor and now thriver on an incredible mission. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update, gestational diabetes, a condition that often has no symptoms, catching pregnant women by surprise and putting their babies at risk. I'm Jessica Lovell on the next Morning Medical Update, the danger for both mothers and baby, plus how experts teach expecting moms to protect their metabolic health. Friday at 8.